So today I wanted to cover which exercises or which core exercises are best for my clients with hip or back pain. My name is Dr. Chad Kuhn. I'm a sports physical therapist, and this has been a pretty big complaint that I've seen a lot of my clients have, because the type of clients we like to work with are those who want to keep working out despite getting older in their 40s and 50s and 60s. But if you're having hip or back pain, all of a sudden it makes doing core exercises very challenging. And a large part of this is due to what we call the lumbopelvic rhythm. On the right-hand side of the screen is the appropriate type of movement, where you're getting a posterior tilt, and that's really the key word here, a posterior tilt, which allows your rectus abdominis and the transverse abdominis and the obliques to do what they're supposed to do, as well as your glutes. All right? In terms of a lower cross syndrome, if you're not familiar with that is, it's a really tight set of extensors of your lower back and tight hip flexors, compared to weak and elongated core muscles and weak and elongated glutes. So what we're trying to do and show you here on the left-hand side of the screen is an inappropriate lumbopelvic rhythm, where people do their core exercises in a way that actually encourages the iliopsoas and the erector spinae to fire, opposed to, on the right-hand side of the screen, your rectus abdominis and your glutes to fire, if that makes sense. All right, so let me also show you, just a review of the iliopsoas. So remember, guys, this is the iliopsoas. It connects into the lower lumbar spine all the way down into the lesser trochanter of the femur. And to be honest with you, that's one of the main problems that I see with inappropriate or poorly done exercises. And if that muscle fires too early and too hard, all of a sudden all these global extensors are going to be overworking, firing, compared to what obviously we want, which is the good stuff, like the obliques, the transversus abdominis, and the rectus abdominis. So, in addition to that, I wanted to kind of cover just a couple of exercises that I don't like in this scenario that you have a client that has hip or back pain. So a V-up, or like a hollow hold, that requires a lot of psoas, as well as bicycles and Russian twist. And that's just to name a three. For whatever reason, the commonality of doing core exercises in the fitness professional world is kind of an overuse of hip flexors rather than core, like the insertion of your lower rectus abdominis, the lower abdominals, the transversus abdominis, and the obliques is really what we're going after. So if we can't do those, which ones can we do? And that's really what today is all about. So let's just start super simple, and we'll get into a traditional plank. One of the biggest common faults that I see with this is that people, first off, are extending through the lower spine like that. I mean, it's just, hopefully you've seen that and you know that by now, but I did want to just review that just to make sure we've covered our foundations. So I'd rather have particularly the low back, not necessarily the butt. That's a really tough distinction for a lot of my clients. But to get their low back up towards the ceiling, squeezing their glutes. And then make sure you've seen or observed or analyzed how much weight they're putting through their legs versus their arms. So right there, I'm just hanging on my low back. I'm leaning on my elbows, and I could be there all day. In this one, not only is my low back in a good position, but I've kind of rocked down so that my elbows translate above my head. And when you do that, that makes this exercise infinitely harder and good, as it should be. But this exercise gets butchered a lot. And then when we go into our side planks, what we don't want to see is that the upper body is rotated forwards, like so. People will hold that, and they're just basically hanging on their spine and their ligaments, which is certainly not what we want. And I don't have a view from top down, but make sure that their hips, their head, and their ankles are all aligned. In other words, make sure people are kind of hip thrusting with that, because a lot of times people don't hip thrust enough, and that will cause their hip flexors yet again to work too much. So that's just a brief review of the planks. Another exercise that is good for beginners who are suffering from back or hip pain would be to stir the pot. I would go as far to say that they're probably better off doing this on their knees if they have pretty intense hip pain, because here this does put a lung lever on your rectus femoris. That muscle actually has an insertional head onto the labrum. So just to kind of briefly review that. So this is the muscle that we're looking at right here, and it has a reflected head that actually attaches. You can't quite see it in here, but it actually attaches to the labrum, and it can be what we call pseudopneumonic of a labral tear or labral feeling. So the stir the pot exercise does have a lung lever through the rectus femoris, so for that standpoint, you might want to try it on their knees first. But again, and with all these core exercises that you're going to see from me that I'm going to encourage, almost all of them have the paradigm that you're going to undergo lower lumbar spine stability. And that's really the big difference that I'm going to show you today with these exercises. How do we fire the core, challenging it, but in a stable mindset? So you are going to get a little kind of anti-rotation with the stir the pot. Pretty easily done anywhere. All you need is a medicine ball. So that's the second one. We're going to go over 5 today total. That's the second one I wanted to go over. So another one with the medicine ball are what I call just kind of pre-Pike elongations. And I'm telling you what, this is a really hard one. And what I like about it is that it actually gets a little bit of the serratus anterior to work at the same time. One common fault with traditional plank exercises that people will kind of hang on their rhomboids and their levator scaps, and they'll just bring their shoulder blades closer together. So this brings about a good amount of work too. And this could kind of go right into a pike up as well, but I'm not going to show you that one. This is just kind of a prerequisite of it. So make sure that they're pushing through their arms. And yeah, as I'm showing you here, the progression is with the ball way down, just barely on my feet at this point. So just from a physics standpoint, we increased our lever tenfold, it feels like. So honestly, with this one, what you'll notice is just going down centimeters puts an enormous challenge on the low back, because the low back wants to hinge. That's really what we're fighting, right? Everyone wants to almost dip in through the low spine, because per physics that just makes sense and it's easiest to do that. And what's been most helpful for my clientele to recover, to rehab, to keep working out is to really strengthen the lower abdominals, the transversal abdominis, the insertion of the rectus abdominis, and even some of the adductor insertions around the pelvis. We're trying to really strengthen that up. So the pre-Pike elongations are another great one that you could do with your clients. All you need is a medicine ball with that. The smaller the ball, the harder, because you'll be more parallel against the ground, whereas a bigger ball will actually be touch easier, but you're welcome to kind of play around with that. Each client has a different standpoint on that. But that's the third one I want to go over, and that one's going to lead us right into what I call plank presses. So what's kind of cool about this is that the triceps and the core have a nice synergy. So it's similar, but this time we're going to actually allow the elbows to bend. That's the move right there that we're all fighting, all right? Just take a close note of that one, because that is not what we want to see, particularly if they have hip or back pain, all right? I'm encouraging the lower abdominals there and the glutes, and now we're ready to go. So with this one, I'm going to rock down and back, keeping my core tight, but I'm allowing my triceps to actually get really good work. Keeping the posterior tilt, driving down onto the elbows, letting the elbows softly contact the ground, and then pushing up and out of that. This too is a bear. It's absolutely very challenging, and this one's actually even a little bit more challenging on the triceps with the knees bent like that, because it's a lot more upper body. So that's a kind of cool variation that you could do if you wanted to happen to get a little bit more triceps, and I particularly think that's a little bit more challenging just because you've got so much more work on the triceps. But Again, this is the original variation I wanted to show you, just kind of rocking back and forth. You can play with hand width and positioning. I like my hands to be slightly rotated out into external rotation rather than internal rotation. So that's the fourth one I would encourage you guys to play. And just again, to kind of quickly review, this is the one where it's more of a tricep variation. A lot more work on the upper body, somewhat more push-up kind of mode, but man, that is a lot of work on the core, which feels great. And then the last one I want to go over are simply single arm holds. I can't tell you how challenging this is for a variety of clients. It's a nice kind of whole body core exercise. It again incorporates the idea and notion that we need to be stable through our lower spine. And it tells you a lot when people first get set up. They're not quite sure how to balance on that one arm. They're not sure how wide their feet should go. And what's kind of cool is that you can add a little bit of rotation into it. Instead of just standing there holding it, you can actually add a little rotation depending on where they're at. So this is an anti-extension, anti-rotation exercise. So it kind of gets into the slings of movement a little bit, which is super sweet. And yep, so a progression here, as you might have expected, just getting the feet to be elevated. And I'm telling you what, just holding that for like 10 seconds and then alternating, your clients are going to love and hate you at the same time, which is what you know you want, right? So this would be the progression. You can take that as high as you want, but most people probably won't be able to do that. But again, there's a little bit of a rotational component to it too, so a little bit more of a concentric motion. So those are the 5 that would be a nice place to start if you're dealing with clients who have hip and back pain. And really, it's simply put, minimize the amount of hip flexion that's going on, minimize the amount of motion going on through the lower lumbar spine, encourage more isometric and eccentric tone and motions to the lower lumbar spine, and just make sure people are learning how to stabilize, fighting those anti-rotation and anti-extension forces. I know we get all kind of caught up, we're busy, it's easy to kind of just go into what's simple or top of mind, but try out those 5 exercises depending on where your clients are at in terms of level of expertise and working out, and let me know how it goes. So I hope that was helpful. Thanks again for hopping on. Have a great day.